Chapter 8, the pelvis. The psoas major, attaching superiorly to the vertebral bodies and inferiorly to the lesser trochanter of the femur. Find the navel, move laterally and inferiorly, circle through the tissue with your fingers, moving the intestines aside until you feel the psoas muscle. Apply pressure and wait for a release. Once that spot has released, move inferior and repeat. Now release and move inferior again. Now you are applying pressure just a bit superior to the inguinal ligament. For the inferior portion of the muscle, find the anterior superior iliac spine and then the inguinal ligament. Move just inferior and apply pressure with your thumb and wait for a release. This work on the psoas can also be done from the opposite side of the table. It can also be performed with the client sitting. To work the inferior attachment of the psoas, find the ASIS, then the inguinal ligament, and move further inferior. Press firmly into the tissues medial to the rectus femoris, and wait for a release. If you feel a strong pulse, you are on the femoral artery, and you should move laterally until you're off the artery. The iliacus, attaching superiorly to the iliac fossa and inferiorly to the lesser trochanter of the femur. Find the anterior superior iliac spine, move medially with your fingertips and apply pressure into the iliacus. Move your fingertips back and forth to elicit a release. You can also do this with a thumb. Another way to perform this technique is with your client prone, using your fingers to reach around under the ilium and apply pressure. The coccygeus, attaching laterally to the ischium and medially to the sacrum and coccyx. The levator ani, attaching anteriorly to the ischium and posteriorly to the anococcygeal ligament and coccyx. The obturator internus, attaching laterally to the greater trochanter and medially to the pelvis. To release the pelvic floor muscles, feel for the coccyx. Now shift the thumb inferiorly, press into the tissue on either side, and wait for a release. To release the obturator internus, shift the thumb inferiorly, apply pressure with your thumb in a lateral direction. the gluteus maximus, attaching superiorly to the ilium, sacrum, and coccyx, inferiorly to the femur. The gluteus medius is located here and attaches superiorly to the ilium and inferiorly to the greater trochanter. The gluteus minimus is deep to the medius and is located here. It attaches to the ilium and greater trochanter. To perform myofascial stretches on the gluteals, place one hand on the iliac crest and the other inferior. Stretch the hands apart and wait for a release. Be patient. Myofascial release should last 2 minutes or longer. To release the gluteals, use your palm to glide down the muscles. Move laterally and repeat. You can also use your knuckles. Another option is to use your fingertips. Finally, you can also use a supported thumb. Another way to release these muscles is in side posture, using your thumbs to glide inferiorly from the iliac crest to the greater trochanter. Here we're releasing the gluteus medius and minimus. To apply compression, use your thumbs to search for tender spots. When you find a tender area, hold and wait for a release. Keep moving and cover the entire muscle group. To reverse anterior pelvic tilt, place one hand on the buttocks near the iliac crest, the other hooks on the ASIS. Pull the ASIS superiorly, while the upper hand pushes inferiorly. Do this gently, and be patient. Wait for the pelvis to slowly shift in a posterior direction. Be patient. Myofascial release should last 2 minutes or longer. Another way to reverse anterior pelvic tilt is to sit next to your client. Place one hand under the ilium, the other on the ASIS. Flex your client's hip. One hand pulls the ilium down, while the other pushes the ASIS up. Ask your client to extend their hip against you with 20% of their strength. Release and repeat, each time moving forward a little bit. The piriformis, attaching medially to the anterior sacrum and ilium and laterally to the greater trochanter. Find the greater trochanter and then find the sacrum. Halfway between, apply pressure with your thumb onto the piriformis. Wait for a release to occur. Explore and release the entire muscle from the sacrum to the trochanter. You can also use a covered thumb to perform this technique. To apply compression with stretch, find the greater trochanter, then apply compression to the muscle with your fist. Pick up the leg, knee bent to 90 degrees, and internally rotate the leg. Then return to neutral. Our model has a restriction in this motion. Most people should be able to reach about 30 degrees internal rotation. Repeat this a few times as you apply pressure to the piriformis. The obturator externus, attaching medially to the obturator foramen and laterally to the trochanter. Find the tendon of the adductor brevis, move laterally and apply compression to the obturator externus, which is deep. Hold and wait for a release. The quadratus femoris, attaching medially to the ischial tuberosity and laterally to the greater trochanter. Find the ischial tuberosity, move just laterally, and apply pressure with your thumb into the crease of the buttocks on the muscle. Work out the muscle as each area releases.